Hello there, and welcome to another episode of Facebook Live. Today I'm going to talk about, we're going to continue on our hormone series for the month, but today, since it's Facebook Live Day, I knew that talking about hormone levels will take a little bit longer, so that was going to be our topic. So it's really about checking hormone levels and their value and how confusing it is, because really there's never been something set that's the way it's supposed to be. And so talking about it and educating you, the beautiful patient and consumer, I think is where it's at, so that you can be your best advocate. Before I get there, I just wanted to comment on three things about today I've seen today. One, I want to send kudos to this one beautiful gal. They're all beautiful gals and guys that we get to see. But her homocysteine went from 18 to 7, woo! And her vitamin D is normal, and all of her lab values just look so much better with the things that she was doing, and I'm just so excited for her. It's really fun to be part of that journey with people and be able to look and see the progress, not only in how you feel inside, but also it translates on paper. It always does. It's so fun. And then the other thing is another patient that's been working with us for a while finally has started to make a lot of changes in how her body's feeling, and she's losing weight. And the biggest thing she did is quit drinking Pepsi. I'm not saying Pepsi is bad or Pop or those companies are bad companies. I'm just saying sometimes when you consume sugary beverages, it makes it hard for you to lose weight. And for her, she articulated that that was the big thing that she finally had changed, and it has resulted in really great, amazing things for her. And then the other thing I wanted to mention was I was talking to a mom this morning who just had a lot going on in her life. And you realize as women, whether we're moms of pets or fish or other humans or whatever it is that we're part of, a lot of times women are the center of that circle that they're in. And we give, and sometimes it's hard to realize how much your energy has to do with how much you're giving out to that world around you. And she made a really great analogy that when our munchkins are little, we listen to their body and their body language, because they can't say, hey, this is what's going on. They're just cry or what they're looking at or what they're like squirming at. We try to make all these associations. We try to make all these associations with nonverbal cues for our children, but we don't even listen to our body in that same way. And I thought that was just so interesting and an amazing point, because it's so true. We do all these things for other people, but somehow we lose applying them to ourselves. So if we can do that for others, we certainly know how to do it for ourselves. We just have to be mindful for it. And so I just wanted to bring up that thought because it made me take a pause. So on to hormone levels. Here we go. So the first hormone levels that I'm going to start with talking about is males. And the reason I'll start talking about males is I think it's a little quicker. So we're just going to do that first, and then I'm going to get to the girls. And if I get too wordy, hopefully you can just email in or whatever, be like, no, stop talking like that, and then I'll try to get back on cue. So the other thing too I'm trying to be very mindful of this month is have articles and have science, because I think there's lots of people talking about it, but really what's the science? Because science is very objective, I feel, a lot of times. And so if we're talking emotionally, we can get supercharged, but if we go to the science, then hopefully it gives us more objective data to work with. So let's take it with males. So with males, a lot of males, if they're taking testosterone, a lot of times they're on testosterone cypionate. Now, some may take some propionate, some may take some ethionate. What's the difference between those testosterone preparations? It's how many ester groups they're actually bound to. Meaning, if this is a testosterone molecule, it's the part that works. But how many ester groups that it has chained to it defines its half-life. The less ester groups, the shorter the half-life, and the faster the onset of action. So, one thing that I find with a lot of males when they come in is if you go in and see a physician or a provider, you say, I'm on testosterone, they're like, let's check your levels. Well, I want to educate those beautiful guys and gals that testosterone when it's injected is not a steady state in the body. If I give you an injection and I check your blood the day after, or the day after, or the day after, it's a different number every day. So that number does not define your wellness. It's the amount of time that you have the therapeutic effect. So I've had patients go get checked, and they got checked at the peak of their injection, and they're told they're on too much, and that's not true. You're checking it at a time that is when there's the most in the body, but every day it goes down. So you can't check testosterone levels that way and expect that that is going to help people feel better, because it doesn't translate. So what I did is I printed off, how fun is this, the actual package insert from testosterone cypionate that is actually made from Pfizer. And so this is what they say. It says that should be given IM. Some people I know do it sub-Q. The suggested dose depends on the age, sex, and diagnosis of the individual patient. Dosing is adjusted according to the patient's response and the appearance of adverse reactions. So that means not one size fits all, although a lot of times you can get a little bit more standard with dosing, but even the package insert from Pfizer says one size does not fit all. The other thing they say is for replacement in an older male, anywhere from 50 to 400 milligrams every 2 to 4 weeks. Parental drug, parental, which is IV, should be inspected visually for particulate matter, blah, 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 about the package insert, but the half-life of the testosterone is 8 days. So what I like to do for patients is, you have to realize too, if you're giving yourself an injection to feel better, and you're doing it once every 10 days, that's kind of irregular, and that's hard for us to be consistent with, and consistency helps us feel better. So I usually recommend that people find a route of or a way to dose themselves on a consistent basis so they consistently feel better, whether it's once a week or once every couple of weeks. So I'm going to draw a picture. So when I give a shot of testosterone, it goes up and then it comes down. The amount of time that they're over that line is where they feel good. So if I'm checking a value day 2, I'm going to get much higher, or day 3 or 4, sometimes it gets higher. Where you usually want to check testosterone levels is right here. So we know that side effects of testosterone include increased estrogen for some men, as well as an increased hemoglobin production for some men. The treatment for increased estrogen production is that you give them Arimidex to block the conversion. The treatment for too much hemoglobin is they can donate blood. Well, what I love to do is make sure that when they're about to redose themselves, that they're not super physiological. You want to make sure that that is within normal limits a lot of times. And within normal limits depends on the lab that you're going to. So I like to kind of review that with people, see where their lab is, because all these labs are different. It depends on the people in their population that they're looking at. So sometimes people can have it a little higher, and that's super normal. You just have to, again, let's read the package insert, what they say. And the package insert says you should dose dependent on age, gender, the diagnosis, and how the patient's response is. So that means the number does not define you, you define you. And that's the most important thing about all of this stuff, is that I think so many times we're looking at a piece of paper to try and make us normal, or try to make us what we're supposed to be. But testosterone, whether you give it to men or women, or hormones, including estrogen and progesterone for women, we're trying to titrate to what it feels like to be the best in your body. The number doesn't define that, you define that. And so, anyway, I think that's a really a critical pearl that you'd want to learn from this. So, so what I find with men is that I'm really trying to figure out how long it takes them to burn through the dose that we're giving them. And I want to make sure they don't go too high, and I want to make sure they don't run out before their next dose. So that's kind of really basic testosterone supplementation and how I check labs for men. And why I feel like people get really confused with testosterone levels, because people are checking them at these erratic times, which are not defined, and it's actually not recommended that you get it checked then. But if you don't know that, it's just so easy to say, oh, I went to my doctor and I really want to be checked because I want to know what it is. But be mindful, as that individual on testosterone therapy, ask yourself that question: when was my injection, and when should I get it checked? Because that's the most important piece of the puzzle. Okay, so the next thing I want to kind of briefly touch about is hormone levels for women. Woo! This gets a little complicated, and really it's easy, but the more you think about it, so I'm going to try and make it as straightforward as possible. Okay, so with men, men's testicles don't just quit working for them. It kind of gradually goes down. But hormones help you with energy. Okay, so something gradually leaving you, you notice less than something going, and so when it goes up and down really quickly, your body's like, what the heck was that? And your body perceives it. So that basically is happening in a female's body from the age we're like 35 to when we're 51 to 52. So the closer to 51 to 52 it gets, the more up and down we get. But for like 15 years before then, we're experiencing change. So literally, your ovaries are being inconsistent about their support of your energy from the age of 35 to 51 to 52. And as a female, I've found that no one in my 40s has ever said, I need you less. I need you to stop doing what you've been doing before. No, it's a time that we're like ramping up. We have a high level of output, but we have inconsistent input from our bodies, which makes us feel a little squirrely and a little out of control of our body. So if we can just understand that, and we stop feeling like there's something super wrong with us, and we understand that we're actually like pretty darn normal. Okay, now we got that out of the way. So if you're up and down and all around from a hormone level perspective, you can imagine, okay, when you don't have a period for a year, the definition of that is menopause. I check your hormone levels then, they will be consistently low. That's when I can check a girl's hormones level and they are consistent. That before you start having periods. Once you start having periods, every moment of every day in the cycle, your estrogen level is different. It is, look at the lab. The lab says you're anywhere normal from 39 to about 400. Woo, that's quite a variation. Your testosterone level is different. Your progesterone is only present in the latter half of your cycle because that's when the corpus luteum cyst can make progesterone. So it's totally dependent on the day and the time that you're looking on a woman's ovaries about what their estrogen, progesterone, and testosterone levels are. So if I check a snippet at a time, so I'd be closing my eyes and throwing it at a dart in the wall and being like, well, that's what it said it was. So it's much more helpful for me to actually talk to a woman and hear her. So she's like, I'm having a cycle every 28 days. Then I know, okay, like what day would you get it checked on? And then the labs mean so much more to me because I can apply the labs to what you're saying, because you as a female are much more important to this than the piece of paper, because there's just so much variance in there, it's hard to interpret. Now so if people come in and say, what are my labs showing? And they look normal, but you haven't had a period for 3 months, and I checked your labs right before you had a period, it doesn't discount that you haven't had a period for 3 months and you're starting to go through menopause or perimenopause. I hope that makes sense. It's that what happens is if you haven't had a period for 2 months, it means your ovary, and you're 48, a lot of times your ovaries didn't work for 2 months. And so if I check your lab values there, I can see it. Well, if your ovaries decided to kick it back up for that month before you came in, and I check your lab right here, right before you had a period, your hormone levels look more normal because your ovaries picked up. But you still feel real crazy because it's been 3 months of feeling weird. So you tell me more than that piece of paper, all right? The confusing part for some people too gets this thing that if you've had an ablation where we burn the lining of your uterus, there's no blood coming out of your vagina to help you know where you're at. You're like, heck if I know. I just feel good some months and not others, and I'm 48 years young and I don't know what the heck's going on with me. And I'm like, oh, she's so normal, right? So here is what the American College of OBGYN says about hormone levels. Let's read this. Okay, yay, how fun is this? Because I'm classically trained first, so this was like drilled into my head, and then I'm functionally integratively medicine trained second. So I like to kind of integrate those concepts as to what makes sense to me about what really works, because I know I can't define a woman by her hormone levels. And the hormone levels don't define you. Okay, so this is what they say. Okay, so this is regarding hormone level testing and compounded bioidentical hormone use. But this is from the committee opinion, compounded bioidentical menopausal hormone therapy in August of 2012. Okay. Many advocates and compounders of bioidentical hormones recommend the use of salivary, like checking your saliva, hormonal level testing, and other proposed mechanisms such as serum, which is blood, and urine testing, meaning I peed for like 24 hours and I sent it in, as a means of offering individualized therapy. However, individualized testing only is indicated when a narrow therapeutic window exists for a drug or a drug class. This includes drugs with a nonlinear pharmacokinetics that have clearly defined therapeutic and toxic concentrations based on large population pharmacokinetic studies of serum concentrations. So, have there been large population pharmacokinetic studies of serum concentrations on testosterone cypionate? Have there been large population pharmacokinetic studies of serum concentrations on bioidentical hormones? So, steroid hormones, such as estrogen and progesterone, do not meet these criteria and thus do not require individualized testing. So there is large within patient variability in this testing that can lead to inconsistent interpretation. And second, because the pharmacokinetics of exogenously administered compounded hormones cannot be known, it is not possible to estimate with reliability how and when to test saliva to obtain a representative result. So all I'm trying to say with this, and here's another thing they say, I highlighted these things. If treatment is initiated for symptom control, subjective improvement in symptoms is the therapeutic endpoint, and there is no need to assess hormone levels. Hormone therapy should not be titrated to hormone levels. So the American College of OBGYN, who is my governing body, says titrate to your symptoms, not to a blood level. Bioidentical hormone folks that come in oftentimes are like, you titrate to the serum concentration. So you can see as a consumer that, or as a patient that's doing it, you're like, what do I go with? These people say, if you check hormone levels, that's bananas. But then again, you have some people in this checking hormone levels and being like, but with no standard, and thinking that the hormone levels define you. And then you've got people over here in bioidentical hormones who are trying to define you by a lab test. So you can see that everyone's doing it a different way, and there's no cohesiveness. And as a patient, if you go into someone who you've trusted with your care and they go, oh, this level is off, you get scared and you will quit your therapy, or you feel like there's something wrong. If you believe in bioidentical hormones and these people don't check it, you think they're not hearing you. So it gets super confusing. So let's just take a step back and let's look at the science, okay? So I believe the science is a menstrual cycle has different hormone levels at every moment of every day during a normal cycle. From age 35 to 51 to 52, your ovaries are changing. There's this huge therapeutic window. The numbers don't define you, you define you. Hormones help you not feel so bad. So if you take them and you feel better, we very commonly as human beings want to look at lab tests to define us as normal. What the heck is normal? I have no clue. I feel like we're just asking that we want to feel like we're connected to ourselves and we're not doing anything wrong. So I do check hormone levels for people, for women, like on an annual basis a lot of times, or when they want to know. I do that so that they feel connected and understand the science in their body, and I'm constantly trying to educate them about the use, but slight misuse of labs that listen to your body. Don't define yourself by a number. Because how your body feels is this really complex dynamic balance of your relationships with your family, with your friends, with yourself, your thoughts, your biology, your glucose, how you eat and how you move. It's all there. And don't feel like the number defines you. Because I have a lot of patients, I feel like that takes a long time to work through, because we're constantly trying to feel like we're fitting ourselves into this box, but we don't belong in a box. You belong in a relationship with yourself. So even the American College of OBGYN says lab numbers aren't supposed to define us. I think that's so cool, because I just find more and more conventionally minded individuals trying to check lab values, but they're completely unaware of a therapeutic window of how these things follow, which leads to even more confusion, which leads to more like irritation on patients and providers, and miscommunication of the validity of the treatment. When you think about checking hormone levels of creams or troches or pills or pellets or injections, I know they all have different things that I'm going to see when I look for them. And so I know I don't check this at this stage. I don't check this at that stage, because I've looked at thousands, literally thousands of hormone levels, and just kind of figured out, oh, this is when you do this, this is when you do this, and pair that with the patient's response based off of conventional therapy, like thought process, how the package insert goes. And it really is, if you understand the science behind it, this is really not that hard. But a pearl I want everyone watching this to kind of take to heart is, listen to your body, understand the science, and if you have a question, reach out for information, because fear fear does not drive connection with yourself, and it doesn't help you get better. It makes you feel worse and scared and drives your energy down. So reach out, ask those questions. I hope this muddied conversation was helpful for some people. And if you have any questions, Lauren, about any of it? Nope. Okay, cool. All right, have a great day. And tomorrow, I think we're going to talk about neurocognitive benefits of estrogen.